with regards to AI, how do you see AI helping in oncology, or do you see any potential opportunities there?
Lots. I think the bigger challenge with AI is destigmatizing it and regulating it, and we need both to happen at the same time. It's arguably the most important breakthrough in our generation. And while it's amazing and powerful, of course, you need regulation to set boundaries on what we should aim for. But the power is there. If we look at oncology specifically, we've already discussed telemedicine to some extent, but it's made telemedicine so much easier. Now there are just AI-enabled telemedicine platforms that triage and allow access without the human resource. That needs to be regulated, of course, but it is still providing people with access to something that they physically wouldn't have been able to access otherwise. And streamlines this remote consultation paradigm. On our side, on the healthcare provider side, it definitely can streamline our tasks. So scheduling, requesting scans, requesting blood tests, even interpreting them, etc. There's so much that it can do to take away a lot of the admin time for clinicians and free clinicians up to see patients and spend more time addressing their concerns, which is what patients want and what we want to do as well. If we look at diagnosis, I think it's already here. It's already happening. There are already, convolutional neural networks looking at imaging and analyzing, say, mammograms, CT scans, MRIs with extremely sharp sensitivity, in some cases exceeding what human radiologists can achieve, which makes sense because obviously computers can do a lot more than most of us can do in terms of, say, calculations, etc. So it makes sense that AI can achieve this. They can find cancers that we physically can't see. Same for pathology. They have more concordance in many ways, especially in very difficult, rare subtypes or subtypes of DCIS or things that are very difficult in general to classify. Hand in hand with that, you'll also have genetic and molecular profiling. So AI can really help with precision oncology in terms of analyzing next generation sequencing to try and predict which therapies are more likely to benefit patients. So, for example, if we look at immunotherapy, which has revolutionized cancer care, there have been studies looking at machine learning models that predict responses to immunotherapy by analyzing the tumor mutational burden, for example. That makes our job much more precise, which is what we want. When we talk about access, you don't just mean having the drug, you mean getting the drug to the right people who really need it and not treating everyone the same. So if you can predict which patients are going to benefit, you'll want them to get it, and those who don't, you want to spare them the toxicity of the drug. So that personalized medicine really would help. And in oncology, again, if you look at things like radiotherapy planning can be optimized with artificial intelligence. So minimizing how much radiation exposure healthy tissue will experience and maximizing it to the areas you really want. I think those are really the main areas where it can help streamline things from diagnosis to treatment.
Yeah.
But we have to look at the ethics, we have to look at regulation, and all of these tools that people develop must be validated in a real world clinical setting on the population you want it to use. Because many people say AI is great, but they might not understand that AI is only as good as the data it's trained on and the questions you're asking of it. And if you're in the Caribbean and you're using AI that's been tested on, say, Western European populations, that really is inaccurate for the population you would have at home. You'd want those models to train on people in Trinidad, St. Lucia, etc., so that you can reproduce those results. So it is very exciting. There's a lot of power, but the regulation is key, I think.
Cautious optimism.
Cautious optimism,
Yeah. It's a good way of putting it.
Yeah, very good.